Hi, Lindsay Peddle, Director of Communications with the Royal Alexandra Hospital Foundation, and we are here today at Anytime Fitness Kingsway with Dr. Ben Terrell from the C.K. Huey Heart Center at the Royal Alexandra Hospital. Thanks for being here, Dr. Terrell.
Thanks for having me here, Lindsay.
You bet. So we're here to talk about heart healthy living as we just kicked off Heart Month at the C.K. Huey Heart Center. And I wanted to ask you, Dr. Terrell, when it comes to the old debate of weight training versus cardio workout, what really is best for the heart from a cardiologist's perspective?
That's a great question, Lindsay. I think really the key is do something. I'd say 95% of my patients don't do anything before they've had their heart attack. So I think to prevent heart disease, you want to start getting active, whether it's doing cardio or low intensity training or weight training. As long as you're doing something, you're ahead of the curve. I'd say the current recommendation we have is even going for a walk 20 minutes a day and doing some resistance training twice a week, and you're really getting off to a good start as far as heart health.
Great. So it sounds like it's safe to say all exercise is good exercise. Maybe talk to us about that heart rate. Where do you want to be in a beats per minute? If I'm looking at, I think we all wear fitness watches these days, where should I aim to be if I'm looking to get a good cardio workout in?
Yeah, great question, Lindsay. So, kind of the classic teaching is 220 minus your age and then 85% of that. For lots of patients or lots of people who are just starting a fitness program, that's probably a little bit aggressive. So I think if you haven't been doing anything for a while, you want to kind of target a little bit lower heart rate to begin with, maybe closer to 65% of that. And from that point, as you build up your fitness, you can start training harder and start targeting 85%. And doing that in a supervised setting to begin with is probably a good idea.
Great. So that's our exercise goal. What about our resting heart rate? Is there a certain level most people should be at? And if they're too high or too low, what are the concerns?
Yeah, so I think the classic teaching is, a resting heart rate between 60 and 100. Lots of people who are really fit, they're going to have a lower resting heart rate. If you have a higher resting heart rate, it can be a sign of deconditioning, so that you haven't been doing enough. And as you get in better shape, you'll see your heart rate start to get down in the lower range of normal. People who have a higher resting heart rate to begin with can be a sign of something going on, like an arrhythmia, so a problem with the electrical system of the heart. The other thing is if you have a really low resting heart rate and you're dizzy and you're not in really good shape, that can be a sign of an electrical problem in the heart that you may need a pacemaker. So that's something you should check out with your family doc before you start exercising.
Sure, so talk to us. I think you probably see a lot of patients that are also facing mobility issues as well. What kind of exercise would you recommend for those who might not be able to run the 10K or be here lifting weights?
Yeah, definitely. Lots of people have problems with their joints, knees, hips, and they're not going to go out and start running through the river trails. That being said, lots of good exercises that are low impact, like using a recumbent bike or doing things like aquasize or swimming is a lot easier on your joints. If you have bad problems with osteoarthritis, I think that's a good exercise. And as I said before, just do something and you're ahead of everyone else.
Great, thanks so much. So we are here today to really celebrate Heart Month. And yesterday we kicked off the Stair Challenge at the C.K. Huey Heart Center. So maybe tell our viewers a little bit about that and the history.
Great, yeah. So the Stair Challenge is kind of a C.K. Huey invention. It's been going on for now 3 or 4 years.
Yep.
Lindsay, you can confirm
Yep.
that. And we are looking forward to having our team, the Doc Jocks, come in first. We've never won that, but we're hoping this year that between Dr. Fensky, myself, Dr. Jones, and I think Dr. Brass last year, we are a close second.
Okay, climbing for a cause. You can go to our website at royalalex.org/heartmonth and register your own team and make your own heart healthy commitment for February.